Welcome to my humble home. Get comfortable and let's discuss the principles of exposure and image quality. Now that we have covered the basic components of an X-ray machine and how X-rays are produced, we will next explore the prime factors of X-ray exposure and how to control those factors. You will begin to observe the effects of exposure on radiographs and start to understand how the various factors controlled by the limited operator affect the final image. Exposure is a broad term used to describe the X-rays that the patient is exposed to, the amount of X-rays in the primary beam, and the amount of X-rays that reach the image receptor, or simply referred to as IR. The X-ray beam is often described in terms of its quantity and its quality. The principal factors that affect X-ray quantity are milliampere seconds, MAS, kilovoltage, kVp, source image receptor distance, SID, and filtration. The factors that affect X-ray quality are kVp and filtration. Note that kilovoltage and filtration affect both quantity and quality. The four prime factors control the quantity and quality of the X-ray beam, and it is important to note that these factors are under the direct control of the limited operator. The prime exposure factors are milliamperage, exposure time, kVp, and SID. These four prime factors are very important to remember. First off, the way milliamperes affect images are that they control radiographic density. Key points to think about are that MA controls the quantity of X-rays produced. They are controlled by adjusting the MA, and the quantity of exposure is directly proportional to the MA. Similar to MA, exposure time in seconds controls radiographic density. Exposure time also controls the quantity of X-rays produced. By adjusting the timer in the X-ray circuit, exposure time controls the duration of exposure and quantity is directly proportional to the exposure time. The radiation dose to the patient is also directly proportional to the total exposure time. The commonly used unit to indicate the total quantity of X-rays in an exposure is milliampere seconds, abbreviated MAS. As stated earlier, this unit is the product of MA and exposure time as shown in this equation. Remember, the quantity of exposure and the patient dose are directly proportional to the MAS. The unit MAS is used as the primary controller of radiographic density. It is important to understand that the MA, exposure time, and the resulting MAS all follow the same directly proportional rule regarding exposure and dose. If any of these three factors are doubled, the exposure and the patient dose are doubled. If any of the three are cut in half, the exposure and dose to the patient are cut in half. Next, let's talk about kilovolts peak, or simply abbreviated as kVp. This factor is the primary controller of radiographic contrast. kVp controls X-ray penetration and controls both the quantity and quality of the X-ray beam. As the kVp is increased, the energy of the photons in the beam is increased, changing its quality. As the photon energy increases, the penetrating ability of the photons increases. When larger or denser body parts are X-rayed, the kVp is increased so that the photons can get through the body part and reach the IR. The kVp is the primary controller of the X-ray penetration. The source image receptor distance, SID, is the distance between the tube target and the image receptor. The SID affects the density and intensity of the X-ray beam. The quantity of exposure is inversely proportional to the square of the distance. This brings me to the inverse square law. This law expresses the relationship between the SID and the beam's intensity, which states that intensity is inversely proportional to the square of the distance. The inverse square law is expressed mathematically as a formula where I is the intensity and D is the SID. This may sound confusing. Keep in mind, for all SID calculations, the distance is always squared. As the distance increases, the intensity decreases, and vice versa. This makes sense because the further away the X-ray tube is from the patient, the less intense the beam will be. For example, if the distance were doubled, the intensity would decrease to 1/4 of the original intensity. If the distance were reduced 50%, the intensity would increase by 4 times. Okay, we quickly just discussed the 4 prime factors of radiographic exposure. Now let's discuss the prime factors of image quality. The four factors that affect the X-ray appearance is density, contrast, distortion, and spatial resolution. Density and contrast are considered photographic properties, and distortion and recorded detail are considered geometric properties. Understanding these factors is essential when evaluating X-ray images, as each factor is influenced and controlled differently. Understanding these concepts enables the radiographer to identify any problems in X-ray quality. Now let's talk about photographic properties. Density is a photographic property that refers to the overall darkness of the radiographic image. When seen on the viewing monitor, an image should be neither too dark nor too light to have the correct radiographic density. Note that density affects the visibility of detail. Some detail in the image is lost when the image is either too dark or too light. Radiographic density results from setting the prime factors of exposure. Therefore, the quantity of exposure to the IR determines the radiographic density. The greater the quantity of exposure, the darker the image will be. Density is primarily controlled by varying the MAS, usually by increasing or decreasing the exposure time. Although KVP and SID also affect radiographic density, they are not used to control it. SID is usually kept constant, and KVP controls contrast and penetrates the body part. Be careful not to confuse radiographic density with tissue density, which refers to the mass density of the body part. Increased tissue density, as in bone, for example, causes a lighter area on the radiograph because it absorbs more primary radiation, leaving less exposure on the IR. However, fat has a much lower tissue density than bone, so it absorbs less primary radiation and produces a darker area in the image. Air has no density and is completely black on X-rays. Using digital imaging, the X-ray exposure is processed in a computer and all X-ray images are looked at on a viewing monitor. In this digital environment in which there are no longer films, the term brightness is used in place of density. The brightness, density, on the viewing monitor is adjusted by a control called the window level. Because of the newness of the digital environment, density continues to be used to evaluate the blackening level of the image. Next is contrast. Contrast is a photographic property defined as the difference in radiographic density between adjacent portions of the image and is a critical factor in the visibility of detail. Contrast is what makes the anatomy more visible. Images with too low a contrast have little density difference between the anatomical structures. They have a flat, gray appearance, and details may be so similar in radiographic density that they are challenging to differentiate. Images with too much contrast have a black and white appearance. Optimal contrast can be either high or low depending on the body part. For example, an image of a hand requires a high contrast to be optimal. There is mainly bone and little tissue surrounding bone, whereas an image of a chest requires a low contrast to be optimal. This is because the chest and torso are full of organs around each other with varying different tissue density. A low contrast would be ideal. As discussed in the previous lesson, the presence of scatter fog and collimation directly influences contrast. To review, fog is a general, unwanted exposure to the radiographic image that produces an overall increase in density, causing all parts of the image to appear as though seen through a gray veil. Fog is primarily caused by scatter radiation, and collimation will also affect the contrast in the image. When the collimator is opened too far, scattered X-rays will reach the IR and produce fog. There are geometric properties that affect quality and accuracy of the body part being imaged. Radiographic distortion is a geometric property and refers to differences between the actual subject and its radiographic image. Because the subject is three-dimensional and the image is flat, all radiographic images have some degree of distortion. Distortion is an unequal magnification of different portions of the same object. Radiographic distortion may be categorized by whether it primarily affects the size of the object or its shape. Size distortion is always in the form of magnification enlargement, and shape distortion results from the unequal magnification of the actual shape of the structure. Size distortion occurs when the anatomical part appears larger than it actually is. This distance between the subject and the IR is called the object image receptor distance, OID. When the SID is great and the OID is minimal, the object and its image are almost the same size. However, as the OID is increased, the magnification increases and distortion of the part occurs. Shape distortion occurs when the body part is not parallel to the IR or when the central ray is angled. This distorts the length or shape of the body part. Any angulation of the part in relation to the IR or angulation of the X-ray beam produces shape distortion. For these reasons, effort needs to be made to position the patient so that the object of clinical interest is as parallel to the IR as possible. As you can see on this image, the black line is parallel to the gray IR, and the black line looks the same. Now in this image, the black line is angled and the shape is distorted, shown here. Spatial resolution is also a geometric property and refers to the sharpness of the image, and is referred to as resolution, sharpness, definition, or simply recorded detail. When the resolution is optimum, the edge sharpness of structures in the image is crisp and accurately rendered. Poor resolution tends to appear fuzzy or unclear. The umbra is the actual anatomic area shown in the radiographic image, and the penumbra describes the unsharp edges of the umbra. All body parts will have some fuzziness at the edges in the radiographic image, which should be reduced as much as possible. To promote understanding of how spatial resolution is maintained or improved, several terms are used. To state it again, the umbra is the actual anatomic area, body part, or structure shown in the radiographic image. The penumbra describes the unsharp edges of the umbra or body part. All body parts will have some unsharpness at the edges in the radiographic image. The goal in radiographic imaging is to reduce the penumbra as much as possible. Penumbra is referred to as blur or geometric unsharpness. The geometric factors that control the formation of the image are SID, OID, and focal spot size. If these three factors are managed properly, the maximum spatial resolution will be seen in the image. A small focal spot produces less penumbra than a large focal spot and produces greater spatial resolution. Increasing the source image receptor distance reduces penumbra and creates greater spatial resolution. When there is a significant OID that cannot be minimized by positioning, increasing the SID and using the small focal spot will improve image quality. Any movement of the patient, the IR, or the X-ray tube during radiography will cause blurring of the radiographic image, reducing spatial resolution. To prevent motion, the IR is placed in a firm, stable location, and the tube is locked in position. Effective communication is critical in avoiding patient motion, and the principal means of controlling involuntary movement is to use a short exposure time. Quantum model is when a grainy or mottled spotty image is created. It occurs when the imaging system does not record the anatomic densities, usually because of a lack of photons. Quantum model will happen when either the MAS or the KVP is set too low, resulting in a blotchy, grainy, or noisy image with decreased spatial resolution. The OID, SID, focal spot, motion, and quantum model primarily control spatial resolution. We went over the main principles of exposure and image quality. To summarize, the prime factors of exposure are described in terms of its quantity and its quality. Remember the prime factors that affect the quantity and quality of X-ray images, so that when you are out there, you obtain the best-looking X-rays possible for diagnostic purposes. Thank you for sticking with me with this lesson. Now let's play some video games.